Are you searching for answers about the relationship between Adderall and mental health? Look no further. In this captivating exploration, we delve into the effects of Adderall on anxiety and depression. As the demand for pharmaceutical interventions for mental health issues continues to rise, it's essential to understand the potential benefits and drawbacks of medications like Adderall. While Adderall is primarily prescribed for Attention Deficit Hyperactivity Disorder, ADHD, it is sometimes used off-label to treat anxiety and depression. However, the impact of this amphetamine-based stimulant on these conditions is a topic of ongoing debate and research. Join us as we navigate through the complexities of Adderall's effects on anxiety and depression, shedding light on the potential risks and rewards of this widely prescribed medication. Whether you're seeking information for personal understanding or are a healthcare professional looking to stay informed, this video is your comprehensive guide to unearthing the truth about Adderall's impact on mental health. Understanding anxiety and its impact on daily life. Anxiety is a common mental health condition characterized by feelings of unease, worry, and fear. It can manifest in various ways, such as generalized anxiety disorder, panic disorder, social anxiety disorder, or specific phobias. Individuals with anxiety often experience physical symptoms like increased heart rate, sweating, trembling, and difficulty concentrating. These symptoms can significantly impact daily life, making it challenging to carry out routine tasks or engage in social interactions. The prevalence of anxiety disorders has been steadily increasing, with millions of people worldwide affected by this condition. Anxiety disorders can have a significant impact on a person's quality of life, affecting their personal relationships, work performance, and overall well-being. Living with anxiety can be overwhelming and debilitating, leading individuals to seek effective treatments to alleviate their symptoms. While therapy and lifestyle modifications play a crucial role in managing anxiety, medication can also be prescribed to provide relief, especially in severe cases. One such medication that is sometimes used to manage anxiety is Adderall. How does Adderall work in managing anxiety? Adderall is a central nervous system stimulant that contains a combination of amphetamine and dextroamphetamine. It is primarily prescribed for individuals diagnosed with Attention Deficit Hyperactivity Disorder, ADHD, to improve focus, attention, and impulse control. However, some healthcare providers may prescribe Adderall off-label for the treatment of anxiety and depression. In the case of anxiety, Adderall works by increasing the activity of certain neurotransmitters in the brain, such as dopamine and norepinephrine. These neurotransmitters play a crucial role in regulating mood and emotions. By enhancing their activity, Adderall can potentially reduce anxiety symptoms and promote a sense of calmness. Additionally, Adderall's stimulant properties can increase alertness and concentration, which may be beneficial for individuals with anxiety-related difficulties in these areas. Benefits and effectiveness of Adderall in anxiety treatment. The use of Adderall in the treatment of anxiety is still a topic of debate and ongoing research. While some studies suggest that Adderall may provide short-term relief for certain anxiety symptoms, the evidence for its long-term effectiveness and safety is limited. It is important to note that Adderall is not FDA approved for the treatment of anxiety, and its use for this purpose is considered off-label. In some cases, healthcare providers may prescribe Adderall off-label for anxiety when other treatment options have been ineffective. This decision is based on a careful evaluation of the individual's specific situation, taking into consideration the potential risks and benefits. The benefits of Adderall for anxiety management may include improved focus, reduced restlessness, and increased motivation. However, it is crucial to remember that the effects of Adderall can vary from person to person, and not everyone may experience the same benefits. Potential side effects and risks of Adderall. As with any medication, Adderall carries potential side effects and risks. Common side effects of Adderall may include increased heart rate, elevated blood pressure, decreased appetite, dry mouth, and difficulty sleeping. These side effects are typically mild and may subside as the body adjusts to the medication. However, some individuals may experience more severe side effects or have an adverse reaction to Adderall. One significant concern with Adderall use is the potential for dependence and abuse. Adderall is classified as a Schedule II controlled substance due to its high potential for abuse and addiction. Misuse of Adderall can lead to serious health consequences, including cardiovascular problems, psychiatric disorders, and even overdose. It is crucial to use Adderall only as prescribed by a healthcare professional and to follow the recommended dosage and administration guidelines. Dosage and administration guidelines for Adderall. The dosage of Adderall prescribed for anxiety management will vary depending on the individual's specific needs in response to the medication. It is important to follow the dosage instructions provided by the healthcare provider and not to exceed the recommended dose. Adderall is available in different strengths, and the healthcare provider will determine the appropriate dosage based on factors such as age, weight, and severity of symptoms. Adderall is typically taken orally and should be swallowed whole with or without food. It is important to take Adderall at the same time each day to maintain a consistent level of the medication in the body. It is not recommended to crush, chew, or break the capsules, as this can interfere with the extended release formulation. Precautions and considerations when using Adderall for anxiety. When considering Adderall as a treatment option for anxiety, it is essential to take certain precautions and considerations into account. Firstly, it is crucial to have a thorough discussion with a healthcare provider about the potential risks and benefits of using Adderall for anxiety. The healthcare provider will evaluate the individual's medical history, current medications, and overall health to determine if Adderall is a suitable option. Individuals with a history of substance abuse, heart problems, high blood pressure, or certain psychiatric disorders may not be suitable candidates for Adderall use. It is important to disclose all relevant information to the healthcare provider to ensure safe and appropriate treatment. Alternative treatments and therapies for anxiety management. While Adderall may be an option for managing anxiety in some cases, it is not the only treatment available. There are various alternative treatments and therapies that can be effective in managing anxiety and improving overall mental well-being. These may include therapy, cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, and other forms of talk therapy can help individuals learn coping strategies, challenge negative thought patterns, and develop healthier ways of managing anxiety. Lifestyle modifications. Engaging in regular exercise, practicing relaxation techniques like deep breathing or meditation, maintaining a balanced diet, and getting enough sleep can all contribute to reducing anxiety symptoms. Herbal supplements. Some individuals may find relief from anxiety symptoms by using certain herbal supplements, such as lavender, chamomile, or valerian root. However, it is important to consult with a healthcare provider before starting any herbal supplements, as they can interact with medications and have potential side effects. Other medications. In cases where Adderall is not suitable or effective, healthcare providers may consider other medications specifically approved for anxiety management, such as selective serotonin reuptake inhibitors, SSRIs, or benzodiazepines. These medications work differently from Adderall and may have fewer risks and side effects in certain individuals. Tips for effectively managing anxiety alongside Adderall. If Adderall is prescribed for anxiety management, there are several tips that can help individuals effectively manage their anxiety symptoms while taking the medication. Follow the prescribed dosage. It is crucial to take Adderall exactly as prescribed by the healthcare provider. Avoid increasing or decreasing the dosage without medical guidance. Communicate with the healthcare provider. Regularly communicate with the healthcare provider regarding the effectiveness of Adderall in managing anxiety symptoms. They may need to adjust the dosage or consider alternative treatment options if necessary. Attend therapy sessions. Combining medication with therapy can provide a more comprehensive approach to managing anxiety. Attend therapy sessions as recommended by the healthcare provider to work on coping strategies and develop healthier thought patterns. Practice self-care. Engage in activities that promote relaxation and self-care. This may include practicing mindfulness exercises, engaging in hobbies, spending time with loved ones, or engaging in physical activity. Monitor side effects. Keep track of any side effects experienced while taking Adderall and report them to the healthcare provider. They can help determine if the side effects are normal or require adjustments to the treatment plan. Frequently asked questions about Adderall and anxiety management. Can Adderall completely cure anxiety? Adderall is not a cure for anxiety. It can help manage symptoms, but it is not a long-term solution. Therapy and lifestyle modifications are essential components of comprehensive anxiety treatment. Can Adderall worsen anxiety symptoms? In some cases, Adderall can worsen anxiety symptoms, especially if the dosage is too high or if the individual is prone to anxiety or panic attacks. It is crucial to communicate any changes in symptoms to the healthcare provider. How long does it take for Adderall to start working for anxiety? The onset of Adderall's effects can vary from person to person. Some individuals may experience a reduction in anxiety symptoms within a few hours, while others may take longer to notice the effects. It is important to be patient and give the medication time to work. Can I drink alcohol while taking Adderall for anxiety? It is generally not recommended to consume alcohol while taking Adderall. Alcohol can interfere with the effectiveness of the medication and increase the risk of side effects. It is best to consult with a healthcare provider regarding alcohol consumption while on Adderall. Can I stop taking Adderall abruptly? It is important to consult with a healthcare provider before discontinuing Adderall. Abruptly stopping the medication can lead to withdrawal symptoms and may not be safe. The healthcare provider can provide guidance on how to safely taper off Adderall if necessary. Conclusion: the role of Adderall in comprehensive anxiety treatment. In conclusion, Adderall can potentially provide short-term relief for certain anxiety symptoms. However, its use for anxiety management is considered off-label, and the long-term effectiveness and safety of Adderall for this purpose are still being researched. It is crucial to have an open and honest discussion with a healthcare provider regarding the potential risks and benefits of using Adderall for anxiety. Other treatment options, such as therapy and lifestyle modifications, should also be considered as part of a comprehensive anxiety management plan. Ultimately, the decision to use Adderall for anxiety should be made in collaboration with a healthcare provider, taking into account the individual's specific needs and circumstances. Thanks for watching.